let's talk about lung cancer. So we're going to have on at some point a very close friend of mine who's head of uh, lung cancer oncology, medical oncology at UCLA, seeing increased number of cases in younger women who don't smoke. So that's a subset that we need to talk about. But chest X-ray, nothing. If anybody ever wants to take a chest X-ray of you, just thank them. Not recommend show anything. And by the time it shows a nodule, you're in deep trouble. So guidelines say now to have annual low dose CT scanning of your chest. And I said annually, so every year. If you're over 50 and you've smoked greater than 20 pack years, so in other words, 20 years of smoking, okay, annually, and it is, we're picking it up early and it is making a difference. People are surviving, okay, because by and large the 4-year survival of, the 5-year survival of stage 4 lung cancer is anywhere between 10 and 15%. And it's, yes, it is getting better, but it's still the number one killer of men and women. So short of, yes, if you have a persistent cough or you're coughing up bloody sputum, by all means, don't wait. Okay. But in terms of if you're a smoker, that's what you need to do. If you're a non-smoker, it is what it is. Like I said, there's no magic. You have anything to add?
No, I mean, I think you hit the nail on the head, and it seems to be more common, right?
Yeah. And getting more cases and, we talk about radon exposure, really, like in California, we don't have basements. So unless you lived in your parents' basement and, the chances of radon being a significant contributor is not a real
Well, I think
thing.
higher and also in certain parts of the country, and
Right.
if your house is built in like in a mountain or
Or in the Midwest, where everybody has basements. But by and large, it is a disease, of smokers. And secondhand smoke is significant, regardless of what people tell you. It is significant. The next thing, which is a wicked cancer, is esophageal cancer. So there's two kinds. The kind that is associated with reflux disease, GERD, as most of you know, is becoming more common and is now the most common in the United States. The upper part of the esophagus, which is a different kind of cancer, is associated in smokers and alcoholics.
Right.
But the issue is people who have a history of gastroesophageal reflux. And as I said in an earlier podcast, there's a parallel rise. So people who've been on proton pump inhibitors, we're seeing a higher incidence of adenocarcinoma. It's called the esophagus, or where the stomach meets the esophagus. And why is that? Well, because the ow part, which is what alerts you to it, is being nullified by the proton pump inhibitor, the Nexium, the Prolosic, or the old time drugs, Pepsid or Tagamet. But you still have it going on, which is the bile part of your acid. Okay. So you're neutralizing the acid. So if you have a history of reflux, and when I say history, burning, not just one time, but burning or regurgitation, vomiting, gets worse at night when you're laying down, please, you need to get an endoscopy.
Yeah.
Because esophageal cancer, before it becomes esophageal cancer, it becomes something called Barrett's esophagus. So it's a progression. And if you have an endoscopy and they see you have Barrett's, there's something we can do about it. But don't wait. Millions of people are on proton pump inhibitors and, quote, they're fine. Their doctor told them they're fine. They're not fine. You need an endoscopy.
Yeah. And I also think people are better about getting the colonoscopy than the endoscopy, because for some reason there's more talk about it. I got to get your colonoscopy at 40.
Yeah.
And people do. People are good about that. So I think if you're going for your colonoscopy and you have any sort of reflux at all, you're under anesthesia anyway, right? A little sedation, up or done at the same time.
Most good GI guys like your brother, he would say, listen, we're going to do an endoscopy at the same time.
Exactly. So, if you have any history of it, for sure. And that's a good one. And people don't think of that one at all. So that's a good one. And a lot of people just live with reflux. I got heartburn. Let me pop something. They don't think that was cancer. So,
And esophageal cancer, by and large, it's discovered stage 3 or stage 4.
yes.
And it's too late. The only time we save people with esophageal cancer is really early, and it's a big operation. Like that's one of the cancers, just like pancreatic cancer. We used to say in surgery, we still do, as Mike knows, the chance to cut is a chance to cure. And esophageal cancer is one of those, but it takes a big surgery early on in order to save somebody's life.